So blood that was out in the body, delivering its nutrients and its gases, is now returned to the heart. And it returns to the right side. Systemic circulation returns to the right side through the superior vena cava and the inferior vena cava. And of course, right, if we open this up, we're going to see a coronary sinus back here. And that comes from this vessel here. So all this blood that's now deoxygenated is coming back to the right side, and it needs to be pushed to the lungs. And the heart is the muscle to do that job. So it moves away from the heart through the pulmonary artery. The pulmonary artery splits to a left pulmonary artery and the right pulmonary artery, and then keeps going to the lungs and picks up oxygen. It then returns to the left side of the heart through the pulmonary veins. So here's right pulmonary veins. There's left pulmonary veins. And we open up the left atrium and we see these 4 black holes where they're coming back. All right, so systemic circulation with nice oxygen-rich blood is leaving through the aorta. The aorta has 2 coronaries that come right off of it. This is part of the right coronary. This little bit right here is the left coronary. They came from these 2 branches here. As we move up the arch, we see 3 branches. The first is the brachiocephalic, because it's going to take blood to the head and the upper limbs. We have a left common carotid that will take blood to the head, and a left subclavian. And then that aorta moves down and becomes a descending thoracic aorta to the rest of the body. So if you follow that blood flow on a board, right? Is that good? All right. So on this board, see, that'll hang up there. Here's our aorta. Here's our brachiocephalic underneath this vein, the left common carotid, and the left subclavian. So the common carotid is moving up to the head on the left side, right? And this left subclavian is moving over in the shoulder region into the upper left limb, okay? Let's look at the brachiocephalic for a second. Again, it's under here, you can't see it, but it branches, right? Which is why we use this heart, that big heart in the heart models to do the brachiocephalic. So it branches, and it means, right, arm and head. So here it branches and forms the right common carotid, moving up the right side, and the right subclavian. Left subclavian, right subclavian. So now as we follow the subclavians, because we're not going to follow the carotids, into the upper limbs, right side, left side, we have matching, we just have to change the sidedness. So when we're right about here, where your underarm is, that is the axillary artery. So right axillary artery, left axillary artery. As it continues into the arm, right, which we know by the humerus, it is now the brachial, right brachial, left brachial. Now we can name other vessels coming off of this, but there's no need to. So that's all you're going to be held accountable for on the arterial. All right, so now when the blood comes back, because these will keep branching and becoming smaller and smaller, eventually become arterioles that lead into capillaries. Capillaries will exchange all this lovely oxygen, deliver it, and it'll pick up all the carbon dioxide and other waste from the cells. So as the blood returns venous, it's carrying waste, right, especially, and low oxygen. So we typically show the veins as blue. So picking up where we left off, if we're looking at the arm here, what we see for venous return is we see these 2 on the right side and on the left side. And so the one that's more lateral, more to the outside, is called the cephalic, and this would be the left cephalic vein. The one that's on the inside or more medial is the basilic, so the left basilic vein. Turns out the 2 of these are actually joined by another vein that kind of merges them together. And again, they're all draining these right here, hands and forearms. And this is called the median cubital vein, left and right. And this is actually the site of where you do most of your blood draws. Okay. So this blood keeps on moving back to the heart because it's done its delivery. We see these two, right, converge, come together about here. So these would be axillary veins, right and left. And they become subclavian veins, right subclavian, left subclavian. Okay? And now the head is also being drained, of course, because we delivered blood to it through the carotids. We got to drain blood away from it. The drainage is through a vessel called the jugular. So here we have the right and the left. There's another jugular here. So because that one is more towards the outside of the neck, it is the external jugular vein, right external jugular vein, left, right internal jugular vein. Whew, been a long day, right? And then on this side, there isn't, you can't see the distinction between the two. So I would just call that the common. So this is the left common jugular vein. Again, this is an internal, that is an external, and these are the right external and internal jugular veins. So these are draining the head, coming down. The subclavians are draining the upper limbs, and they converge into these two. Right? So as they come together right here on the right and come together right here on the left, this is now the brachiocephalic vein. Since it's on the right side and there's one on the left, you have to say left and right. So right brachiocephalic vein right here, left brachiocephalic vein right there. These two join, and we are back at the superior vena cava. Okay? So that's our circulation through the head and upper body. So let's pick up on that again, arterial delivery. If I move it like this, is this okay? Is it still in frame?
From the waist down.
From about this down?
Yeah.
Okay, so we need a little bit. All right. How about there?
Okay.
Is that good? All right. So in here, this is now our descending abdominal aorta, and it's branching to deliver blood to all the viscera, all these organs in here. So I tell students the first branch here is a celiac. And of course, you can trace the celiac branches into a hepatic because that's your liver. It branches into a splenic because that's your spleen. And what you can't see is the stomach, which sits right here, and so that would be a gastric branch. It continued, blood keeps moving down this, right, a descending abdominal aorta. We have a branch that goes to the intestines. This is called the superior mesenteric, and it's always above the kidneys. And then there's the right renal and left renal arteries, just beneath the superior mesenteric, going right, just branches right here. Then beneath the two renals, there are gonadals. So they're paired as well. So the renals and the gonadals are paired. And so this is a right gonadal, this is a left gonadal, and they are ovaries or testes, depending on male or female. Then the last branch from the whole aorta is called the inferior mesenteric, and you can see it's going to the large intestine here. It then stops, it ends, and it branches into the iliacs, right? Because this is the ilium, right? So here's our common, right common iliac artery, left common iliac artery. It branches again right here and here, so now I have to do what I did up here. I have to give an internal and external. So the deeper one is always internal. So this is a left internal iliac. There's the right internal iliac. And that makes this the external until it gets to the femur. So from here to here, from here down to about here, those are the external iliacs, right and left. We then, once we get into the lower limbs and we see the femur and we're running by the femur, that's the femoral. So you have your right femoral artery, your left femoral artery. That artery, you can see it on this left leg only, goes behind the knee, right? So here's our patella, so back here. So that is the left popliteal artery. It then goes into the leg, and here's our tibia. So we see we're behind the tibia. So ours are posterior, so again, left leg or left lower limb. Left posterior tibia artery, and this is the left anterior tibial artery. And on this side, the right leg, we can only see the anterior one. They just didn't show you the other ones. Right? And just like what happened up here in the upper limbs, you had the exchange of oxygen and nutrients, delivery through the capillary beds, and then you head back through the venous. And now the blood is deoxygenated, so it appears blue on these boards, not in real life, but it looks darker in real life. And so we want to trace this venous flow. Well, you'll notice that they completely cut them off on the left leg. That's okay. It's a model. It wouldn't happen in you, but that means you don't have to worry about those. But please know they are there. What they emphasize here are the two saphenous veins. So there's a small saphenous, and again, it's a right small saphenous vein. And there's a very long one. In fact, it's the longest continuous vessel in the body called the great saphenous. And again, this is the right leg, so that is the right great saphenous vein. There's a little bit of the right femoral vein here that's running with the right femoral artery. But we don't see much of anything here on the left side. So as these drain the lower limbs, they come back. It's like reversing how you went out. So here, from here to here, that's a left external iliac vein, right external iliac vein. There's my internal iliac veins. And so this makes this and this the common iliac veins, right and left. And they converge into the inferior vena cava. Flow back to the heart is a little different in the abdominal cavity, so just a few things to note is the renal veins go directly into the inferior vena cava, but a lot of the other veins actually go through the liver. So here we have splenic vein coming in, inferior mesenteric, superior mesenteric, or excuse me, inferior mesenteric, superior mesenteric coming in to here, which is your hepatic portal. Blood flows through the liver and then drains it through this vessel here, which is called the hepatic vein. And then we're back to the heart. So this is a basic, right, blood flow through the board model. If we try to transfer that to a couple other models here, I'll start with the easy transfer. A lot on this model, really all we see really well is this splenic, because there's our spleen, so we can see this. So they cut off, this is the back of it, they have cut off the abdominal aorta. So I told students, this is your celiac branch right here. So this would be a hepatic. You can see this one going to the spleen. That's probably the gastric. This is probably the superior mesenteric, right? And then you see your renals here and here. But I really honestly, using this model for those would not be, I probably wouldn't use it for anything but the splenic. This is a new model we received, and it's kind of cool. It does show you a few of those things. So here again, the celiac trunk is really nice. And there's our splenic, because that's a spleen this time. And here we're going over to the hepatic, because that's your gallbladder, and the liver would be over here. It's not really made to show you a whole lot. It has some very good renal arteries and, of course, veins. But it's just, we really bought this to complement that, and it's a new model. We use this as well. So now we've got our common iliacs. Do you want me to tilt it, or are you good? Okay. We've got our common. This is the front. There's our pubic symphysis. So this is a common right, a common left artery, and of course the veins are behind it. We really focus a lot on this aorta in this model. So again, your diaphragm would sit right here. So this would be your celiac trunk or celiac artery. Here's that again, that superior mesenteric, because it's above the kidneys. Here's my right and left renal artery. Just beneath it, the gonadals, right gonadal artery, left gonadal artery. And of course, the last branch is the inferior, right? Inferior mesenteric artery, right? So the only other thing or model that we typically use, of course, is, oh my gosh, this large brown torso that I showed you guys. That's not his heart, by the way. I don't know whatever happened to his heart, right? So we can transfer some of the information we got from these other models to him. So if the heart were here, of course, here's our 3 branches. So this looks very similar to the board. It's just larger. And so that's a right carotid, that's a left carotid, and that's a left subclavian. That's the right subclavian. We don't follow them into the axillary or the arms, which aren't here. Right? This is the descending thoracic aorta that goes beneath the diaphragm, which is this structure right here. So underneath here, this would be your celiac trunk, and it's very short. So we're already seeing the 1, 2, 3 branches off of it. So this would be hard for me to actually ask about the celiac because it's underneath these, kind of like what you see on the circulatory board. This is the superior mesenteric. That's easy to figure out because there's a kidney. The other one would be over here. That's a right renal, left renal. Okay. There's my gonadals, right gonadal artery, left gonadal, and I see it going all the way down to his testes. And then here's an inferior mesenteric artery. There's my 2 common iliacs. I see the branching to the internal iliacs. That means that's external iliacs, right? And I don't really worry about following it any further because I have the board models to do that. For the venous, again, you've got the iliac, external iliac vein, internal iliac vein, common iliac, and this is all your inferior vena cava with the 2 renal veins on it. Up here in the head, we do see jugulars. Here's an internal jugular, external jugular. And we see subclavians, right? So here's running with the subclavian artery are the subclavian veins. We've cut the jugulars really close. The subclavian is merging with the jugular, so right between here and here, that is my right brachiocephalic vein, and that is my left brachiocephalic vein. And then I'm at the vena cava. And that really is the extent of what you guys need to trace. So I hope this helps you. And let me know if you have any questions. Thank you.